But our telemedicine experience has started much earlier, since the late 90s. And we right now have a department of telemedicine, and our telemedicine center is also being developed further. Next one, please. Okay. And Postgraduate Institute of Medical Education and Research is an institute of national importance, and it's a pioneer in providing both basic medical care as well as highly specialized quality service to the people of this region, that is Punjab, Haryana, Himachal Pradesh, Chandigarh, Jammu and Kashmir, and also parts of Uttar Pradesh, Uttaranchal and Rajasthan. PGI Telemedicine, as I said earlier, started in 1998 as a project, and later on it was upgraded with connectivity through ISRO and Department of Information and Technology and CDAC to a proper telemedicine center. We had introduction of e-health in 2007, and we have telepsychiatry being introduced in 2009. We had M-Health in collaboration with the Bhabha Atomic Research Center, which had started here around the same time. And in 2012, we got connected to what is known as the National Knowledge Network, and which is a high bandwidth connectivity connecting several institutions in the country, and which enable us to do video conferencing with several institutes. We became a part of National Medical Colleges Network as a regional resource center in 2012 and 13. And later on, National Institute of Telemedicine was visualized, and we have actually been approved to start National Institute of Telemedicine in PGI. We are equipped with all kind of connectivity, and we have connection, of course, with our the National Nodal Center, which is the SGPGI, to which we are connected right now, NIGRIMS Shillong, SKIMS Srinagar, Medical Colleges of India, All India Institute of Medical Sciences, and all the new aims which are being built these days all over the country. We also are having a connectivity through satellite communication with VSAT, which has been established by the Indian Space Research Organization. And we have connectivity to several hospitals in Punjab, which are, some of them are primary hospitals and some of them are community hospitals, like district hospitals, to which we are connected. And we have connectivity to about 28 hospitals in Punjab and also in Himachal. And in Kerala, we are connected to Sabrimala Hospital, where pilgrimage takes place every year in November, and we provide some expert consultations there. Our Punjab linkage was inaugurated by the then Prime Minister of India, Dr. Manmohan Singh, and we are connected to these 25 centers, including 19 district hospitals. And now more than 50,000 consultations have been given to these centers, along with other community connectivity which we have, and when we go out and do camps in the community. So this is the Honorable Minister of Health, who was video conferencing with Afghanistan. As you all know, we had a SARC telemedicine network earlier on, which became suspended in between. But on an individual basis, we are still connecting to these countries and having discussions with them, either through the policy makers or through the doctors and heads of the hospitals. Several delegations from other countries come and get trained in our center, so that regarding the softwares and the hardware requirements. And other clinical services which we are providing are teleconsultation, telemonitoring, telediagnostics, disease monitoring, and of course electronic medical record integration with the telemedicine. About tele-education, I will be dwelling a little further, because we have this connectivity through National Knowledge Network to several institutions, and we transmit our daily sessions to many centers like this. And recently we have started webcasting our morning session, which is on 8 to 9 slot, and also in the afternoon on the national portal, and which can be seen by anywhere, anytime in the country. We have also developed some online web-based courseware, which we are trying to administer to many interested participants which are there, and also some in-house diploma courses. We have a biomedical informatics which are also utilizing the e-library services and their dissemination using tools in evidence-based medicine. We have content development courses and creation of proper telemedicine center. The telemedicine center was connected by the Ministry of Health and Family Welfare to 3 centers where which were far flung. One was in Kinnaur in Poo in Himachal Pradesh, where our primary health center is connected to us. Other one is in Sabrimala, Kerala, where Ayappa temple has a pilgrimage every year, and we are expected to provide expert medical care to them. We also have an annual pilgrimage to Amarnath, and the telemedicine center has been set up in a place called Sheshnag, which is on way to Amarnath temple, and these nodes have been inaugurated by the Honorable Union Minister of Health. Telemedicine center have also been innovating in various M-Health technologies, and which we have deployed in several places now. And this was somewhere in 2016 when we presented our model of telespirometry in the Rashtrapati Bhavan, and later on it was presented in the Vigyan Bhavan to several ministers which had come from African countries, and this was an Indo-African meet which took place. The telemedicine center also participates regularly in educational sessions which are done with remote sites, and this is one session in which one of our ministers is actually participating in telemedicine education given to the peripheral institutions. Now, various research sessions with District Hospital of Punjab have been instituted along with our usual teleconsultation. We have a project called ECO, which is actually being supported by an international agency, where the doctors in the periphery connect to us through the Zoom software, and we try to give them education regarding different conditions. And right now in this you can see a session which was being held on hepatitis B. As far as research is concerned, we have a state-of-art laboratory for hardware and software development in the M-Health sector, and also in telemedicine technology to find community-based solutions using e-health and M-Health technology. What you can see here is a tele-ECG device here, and this was developed in collaboration with the Bhabha Atomic Research Center, where an ECG done in the periphery is directly transmitted to the central station, that is PGI, to a cardiologist who interprets it and gives back the report. And this is the community outreach, and we validated the product which was built by Bhabha Atomic Research Center, and we conducted about 500 such investigations in the periphery on tele-ECG. This is the various kind of activities which go on in Punjab in our PGI Telemedicine Center, where we are giving teleconsultations through EMR as well as through video conferencing, and also conducting various courses which are tele-enabled, and we are able to transmit them to far-flung places like Northeast and also internationally. Now, this is a new initiative which has been started by us in the villages of Chandigarh, which are surrounding the Union Territory. And these are e-health centers which are equipped with several diagnostic equipments, and they are enabling teleconsultations. This is the M-Health Kit tool which is used in this e-health center, which has a telespirometer, a tele-ECG, it has a hemoglobinometer, something to measure the saturation, the blood saturation, the blood sugar. So this is a kit which is being used in these e-health centers. Another one which is, just go back. This is another experience which we are having with telemedicine through our Asha Jyoti van, which is a women's healthcare mobile outreach platform in which women are screened for cancers, various cancers, and several camps are done in the community. And some of these investigations are then uploaded on the website, and which can be easily interpreted by the experts and feedback given to the patients. Then these are some of the CME sessions which we have with our counterparts, say in All India Institute of Medical Sciences and also in SGPGI, where we discuss our difficult cases with them, and several sessions which take place from time to time. And this is a CPC session which is transmitted now nationally on the web, on the national web portal. And several e-sanjeevani consultations take place every month, and we have kind of divided them into specialty-wise consultations. As you can see, we are giving consultations in pediatrics, gynecology, orthopedics, skin medicine, dental, pulmonary medicine, ophthalmology, and several other disciplines where even the pathologists and cytologists send us the slides, and which are interpreted by the experts, and the feedback is given to the people. Recently, we were made a teaching node. We made a teaching node for Indian Space Research Organization, which is connected to 106 centers all over the country, which are in the peripheral locations. They are not medical colleges, they are mostly primary health centers or other small centers where connectivity has been provided by ISRO, and our doctors come here and give lectures to these people. This is just a demonstration of teleconsultation, which is given using e-sanjeevani, which is a platform which has been built by CDAC, which is the Center for Development of Advanced Computing. And this is a web-based software in which you can enter information, and it's very, very applicable to various centers which are there, in which data exchange and information exchange can take place. This is one instance of when we are teleconferencing with POO, that is in Himachal Pradesh, up in the Himalayas. Another new service which we had started was of Tele-evidence. Our doctors sometimes have to go to the periphery to give evidence in the courts whenever there are medical legal cases. So a step was taken by the Honorable High Court of Punjab and Haryana, where they connected us to all the district magistrates, where mostly people have to go and give their opinion. So now onwards, this tele-evidence is done in PGI itself. We have like something like a court which is there, in which the doctors come and they interact with the judges who are located at the remote places, and there would be some data exchange which takes place before the consultation, and the signatures, etc., are authenticated, and then a tele-evidence is recorded. So these are some of the new things which we have been doing, and we were really impressed with the presentation from Asian Institute, where some kind of futuristic vision was presented. And but mostly we are working at the ground level right now, and mostly working to improve the healthcare indicators of the country using telemedicine, e-health and m-health. Thank you very much.